Hello, I'm Ness, President and CEO of Munson Healthcare. Throughout our communities during this pandemic, I am humbled by the expressions of gratitude for our healthcare workers. From red ribbons around trees, to luminaries on porches, and inspiring messages written on our town sidewalks. These messages serve as a reminder of why protecting our staff working on the front lines is more important than ever. You probably heard a lot about the global shortage of personal protective equipment, or PPE, and I'd like to talk about what Munson Healthcare has been doing, along with the generous support from our communities to address this critical need in northern Michigan. First, let me give you some background on why we're in this situation. At Munson Healthcare, we have a very sophisticated supply chain operation. 20 years ago, we built this warehouse to stockpile goods in the event of an emergency. Even so, it was literally impossible for any of us to have predicted the unprecedented nature of the situation we face now. The COVID-19 pandemic has caused a spike in demand for medical supplies that in some cases is as much as 20 times what was previously needed to safely care for our patients. In my over 35 years in healthcare, I've never seen anything like this before. On top of this increased demand for medical supplies, there are fewer supplies available. The reality is that most medical supplies are manufactured in China, where production cycles are significantly disrupted earlier this year by the coronavirus outbreak. Shipments of PPE from our normal suppliers have been virtually eliminated and aren't coming back anytime soon. Clearly, our normal ways of doing business won't work in this new environment, where states and hospital systems are competing with each other in the race to purchase much-needed medical supplies. Quite frankly, this is one of the issues that have been keeping me up at night. As the President and CEO, I feel personally responsible to keep our employees, providers, and patients safe. Thanks to local businesses, generous donors, and a lot of hard work by our community partners, we are still tight in supplies, but in a better spot today than we were a month ago. I have been truly humbled by the outpouring of support of so many individuals and businesses who have stepped forward to help us. I want to thank Dodd Russell, the owner of Skilled Manufacturing in Traverse City. By working directly with his team in China, Dodd helped secure several 100,000 surgical masks and medical gloves for Munson Healthcare. Some, but not all, have arrived at this warehouse in Traverse City and are being distributed across the system as needed. Dodd Russell has been doing business in China for 12 years, and his relationships were essential in both securing and verifying the supply of PPE that continues to arrive in Traverse City. In addition to Skilled Manufacturing, there are many other businesses and community members who have helped Munson Healthcare through the early stages of this pandemic. Who would have thought that local distilleries would be making hand sanitizer as a medical supply? Or that local manufacturers like Britain and Petoskey Plastics would retool to make face shields and isolation gowns? Or that auto manufacturers like General Motors would be sending a convoy of sedans to northern Michigan to deliver 14,000 face shields and 67,000 face masks. We are eternally grateful to business leaders like McKeel Hagerty and Warren Call for making important industry connections for our supply chain team. We appreciate all the diligent work of our legislators for advocating on our behalf. We've also had individuals in our community, like Garfield Township resident Steve Duell, volunteer to scour the market locally for untapped inventory of gloves and masks. To all the sewing circles, church, and school groups who have spent their time and energy sewing the homemade masks, we can't thank you enough. In addition to the incredible efforts of our local communities, Munson Healthcare's supply chain team, led by Mark DePonio, has left no stone unturned. They have been working tirelessly and around the clock to track down and vet reputable sources of supplies and quickly distribute them to where they're needed. Mark and his team have checked and vetted nearly 1,000 sources for supplies. We have also been working closely with some of our health system partners like Spectrum Health to share supply chain connections and are discussing how we can help facilitate medical mask manufacturing in Michigan. We will do everything in our power to protect our team and our community into the future. The shortages we are experiencing in PPE are not due to our unwillingness to invest. In the month of March, we spent nearly $2.2 million on supplies that normally would have cost us $200,000. That's because when demand goes up, so do prices. In many cases, we are prepaying entire costs up front because we have no other choice. Our job now is to be good stewards of our limited resources. And that's a balancing act because there's no guarantee what tomorrow will look like. That's why conserving PPE and supplies remains critically important. This pandemic continues to strain the resources of our local healthcare system and has certainly created personal and economic stress for so many families across our region. But what this pandemic has not done is clouded Northern Michigan's resilience, can-do spirit, and unwavering commitment to the community. I know that I speak on behalf of the entire leadership team when I say that I'm proud to live in an area that embodies these values. No matter how large or small your support, we greatly appreciate your efforts. Please stay safe and be well.